According to the 8th edition of Principles and Practice of Surgery, obstruction refers to a mechanical impedance to the normal propulsive action through the intestine. In this video, I'm going to explain to you in simple terms exactly what that means. So, small bowel obstruction is composed of two key concepts: small bowel and obstruction. Let's break those down. Small bowel refers to the duodenum, jejunum, or ileum. However, duodenal obstruction is best considered separately because duodenum is a retroperitoneal structure, while the jejunum and ileum are intraperitoneal structures. Therefore, in this video, we're going to only consider obstruction of jejunum and ileum as small bowel obstruction. Obstruction then means the failure of contents to go through. So in simple terms, the contents inside the jejunum or ileum can't go through. Now, small bowel obstruction is broadly divided into two types: mechanical and functional. And when we refer to small bowel obstruction in a surgical context, we are usually referring to mechanical small bowel obstruction. Mechanical small bowel obstruction implies the presence of a transition point, which is a point through which the contents cannot pass. So a physical point of obstruction. Typically, the bowel is dilated proximal to this point and collapsed past this point. Functional bowel obstruction or functional small bowel obstruction simply refers to the absence of peristalsis. Both mechanical and functional small bowel obstruction have different causes, and a thorough explanation of these causes is outside the scope of this video, but this will be covered in a future video. As I said earlier, when we talk about small bowel obstruction in a surgical context, we usually refer to mechanical small bowel obstruction with a transition point. So, as we said earlier, obstruction refers to a mechanical impedance to the normal propulsive action through the intestine. I hope that this definition now makes sense. Please subscribe to my YouTube channel and please comment if you have any questions. And if you think you've found any inaccuracies in this presentation, please comment down below, because I need to know if you think there's an inaccuracy. My name's Arrow, I am a core surgical trainee, and I'm here to teach you what I know about surgery. Quick legal disclaimer: so this is not medical advice, this is educational only, and this is not a replacement for guidelines, evidence, policies, or senior supervision. And this video is made with no institutional or NHS affiliation. This is my bibliography. The bibliography is also printed in the description. Thank you for watching. Bye bye.